So next we're going to be talking about some more advanced techniques such as the occlusal and localization techniques. And this starts on chapter 21 of your dental radiography textbook. To go over some learning objectives, first we'll define any key terms associated with the occlusal and localization techniques. We'll describe the purpose of the occlusal examination. We'll list the uses of the occlusal examination and discuss the basic principles involved. We'll describe the patient and equipment preparations that are necessary before using the occlusal technique, and we'll state the recommended vertical angulations for the following maxillary occlusal projections: the topographic, the lateral or left to right, and the pediatric. We'll state the recommended vertical angulations for the following mandibular occlusal projections: topographic, cross-sectional, and pediatric. And we'll state the purpose of the localization techniques and their uses. We'll also describe the buccal object rule and the right angle technique, and list the patient and equipment preparations that are necessary before using the buccal object rule or the right angle technique. Lastly, we'll describe the receptor placements for the buccal object rule and compare the resulting images. We'll also describe the receptor placements for the right angle technique and compare the resulting images. So the occlusal technique is used to examine large areas of the maxilla or mandible. And the purpose of this chapter is to present some basic concepts and to describe patient preparation, equipment preparation, and film placement procedures for both the occlusal and the localization techniques. So the occlusal technique is used to examine large areas of the maxilla or the mandible. This technique is so named because the patient bites on or occludes on the entire receptor. So some terminology that we will go over are occlusal surfaces, which is the chewing surfaces of the posterior teeth; an occlusal examination, which is a type of intraoral radiographic examination to inspect large areas of the maxilla or the mandible on one image. The occlusal technique is a method used to expose a receptor in an occlusal examination, and an occlusal receptor in the occlusal technique is a size 4 intraoral receptor, and the receptor is so named because the patient occludes or bites down on it. So the occlusal technique is a supplementary imaging technique that is used in conjunction with the periapical or bite wing image. The occlusal technique is used when large areas of the maxilla or the mandible must be visualized. An occlusal image is preferred when the area of interest is larger than a periapical receptor may cover, or when the placement of intraoral receptors is too difficult for the patient. And these are used to locate retained roots of extracted teeth, supernumerary teeth, foreign bodies, salivary stones, fractures, and even the cleft palate. The basic principles of the occlusal technique can be described as follows. The receptor is placed with the tube side facing the arch that is being exposed. The receptor is placed in the mouth between the occlusal surface of the maxillary and mandibular teeth, and the receptor is stabilized when the patient gently bites down on the surface of the receptor. It is important to stress that the patient gently bite down on the receptor to avoid seeing permanent bite marks on the surface of the sensor. All right, some step-by-step procedures will include patient preparation, equipment preparation, maxillary occlusal projections, mandibular occlusal projections, and vertical angulations. Step-by-step procedures for the exposure of occlusal images include basically all of these. So starting with patient preparation, after completion of infection control and procedures and preparation of the treatment area and supplies, the patient should be seated. So first, you want to briefly explain the imaging procedure to the patient. You want to adjust the chair so that the patient is positioned upright and the level of the chair is set at a comfortable working height. The adjustment of the headrest will also adjust the headrest to support the patient's head. So for maxillary occlusal exposures, the patient head must be positioned with the maxillary arch parallel to the floor and the midline perpendicular to the floor. For some mandible occlusal exposures, the patient's head must be reclined and positioned with the occlusal plane perpendicular to the floor. And in others, the patient is positioned with the occlusal plane parallel to the floor. You want to place and secure the lead apron with the thyroid collar on the patient and request that your patient remove eyeglasses and any objects in the mouth, such as dentures or retainers or chewing gum that may interfere with the procedure. After patient preparation, equipment must be prepared before the exposure of any receptor begins. This will include setting the exposure control factors such as the KVP, the MA, and the exposure time. Also, you'll use either a short 8-inch or a long 16-inch PID with the occlusal technique. So the three maxillary occlusal projections that are commonly used are the topographic projection, which is used to examine the palate and the anterior teeth of the maxilla, the lateral projection, which is used to examine the palatal roots of the molar teeth, and it can also be used to locate foreign objects or lesions in the posterior maxilla, and the pediatric projection, which is used to examine the anterior teeth of the maxilla and is recommended for use in children 5 years or younger. The three mandibular occlusal projections that are commonly used are the topographic projection, which is used to examine the anterior teeth of the mandible, the cross-sectional projection, which is used to examine the buccal and lingual aspects of the mandible, and it can also be used to locate foreign bodies or salivary stones in the region of the floor of the mouth. The pediatric projection is used to examine the anterior teeth of the mandible and is recommended for use in children 5 years or younger. The following are some recommended vertical angulations that you can use for these types of images. And you can, these are also available on table 21-1 on page 229. So localization technique is a method used to locate the position of a tooth or an object in the jaws. And before the dental radiographer can use localization techniques, a thorough understanding of basic concepts is necessary. In addition, knowledge of the step-by-step procedures is required. So the dental image, as we may or may not know, is a two-dimensional picture of a three-dimensional object. The dental image does not depict the buccal-lingual relationship or the depth of an object. Localization techniques can be used to obtain this three-dimensional information. And the following localization techniques, the localization techniques may be used to locate the following: foreign bodies, impacted teeth, unerupted teeth, retained roots, root positions, salivary stones, jaw fractures, broken needles and instruments, and dental restorative materials. So there are two basic techniques that are used to localize objects: the buccal object rule and the right angle technique that we will go over in just a minute. The buccal object rule governs the orientation of structures portrayed in two images exposed at different angulations. Using proper technique and angulation, a periapical or bite wing receptor is exposed first, and then after changing the direction of the X-ray beam, a second periapical or bite wing receptor is exposed using a different horizontal or vertical angulation. For example, A different horizontal angulation is used when trying to locate vertically aligned images, such as teeth treated with a root canal, whereas a different vertical angulation is used when trying to locate a horizontally aligned image, such as the mandibular canal. So when the dental structure or object seen in the second image appears to have moved in the same direction as the shift of the PID, the structure or object in question is positioned in the lingual. For example, if you have the horizontal angulation that is changed by shifting the PID mesially and the object in question moves mesially on the image, the object lies to the lingual. So lingual equals the same. So you want to look on figures 21-7 and 21-8. This is on page 236 and 237. So as you're looking at these images, these explanations kind of make a little bit more sense. So when the dental structure or object seen in the second image appears to have moved in the opposite direction, opposite as a shift of the PID, the structure or object in question is positioned to the buccal. For example, if the horizontal angulation is changed by shifting the PID distally and the object in question moves mesially on the image, then the object lies to the buccal because buccal equals opposite. What does this all mean? So this refers to a mnemonic, which is labeled SLOB, S-L-O-B, where S equals the same, L equals lingual, O equals opposite, and B equals buccal. So when two images are compared, the object that lies to the lingual appears to have moved in the same direction as the PID, which is why we say same equals lingual. And the object that lies to the buccal appears to have moved in the opposite direction as the PID, which is why we say opposite equals buccal. So the right angle technique is another rule for orientation of structures seen in two images. So in this one, one periapical receptor is exposed using the proper technique and angulation to show the position of the object in superior inferior and anterior posterior relationships. Next, an occlusal receptor is exposed directing the central ray at a right angle or perpendicular at 90 degrees to the receptor. After the two receptors have been exposed and processed, the images are compared with each other to locate the object in 3 dimensions. So if you look at figure 21-9, and this is on page 237, this will make a little bit more sense. So they're talking about in the first object, so they'll take a PA or bite wing there, and this object appears to be located in the bone on the periapical image. But when you go ahead and expose that second occlusal image, it'll reveal that the object is actually located in the soft tissue lingual to the mandible. So this is how the occlusal image shows the object in the buccal lingual and anterior posterior relationships. So the step-by-step procedures for localization techniques include patient and equipment preparations, as well as receptor placement and comparisons. So we'll use the buccal object rule as well as the right angle technique. So with patient and equipment preparations, we'll want to refer to what was talked about earlier, or we'll briefly explain the procedure to the patient. We'll adjust the chair so that it's in a comfortable working height for us. We'll adjust the headrest so that the patient's so the patient's occlusal plane is horizontal or level with the floor. We'll place and secure the lead apron, and we'll request that the patient remove sunglasses, eyeglasses, or any other objects in the mouth, such as a denture, partial, or chewing gum. So the buccal object rule can be used to determine the position of a tooth treated endodontically with gutta percha and a maxillary second premolar. So you'll want to refer to figure 21-10 as I explain this. So if you haven't already, pause this video and go to your book and pull up figures 21-10 on page 238. So first you want to position the patient with the maxillary arch parallel to the floor. Then expose one periapical receptor using the proper technique and angulation. Next, shift the PID in a mesial direction and then expose another premolar periapical receptor. In the second image, when the PID was moved in a mesial direction, the gutta percha moved in the opposite direction. Therefore, the location of the gutta percha is in the root that lies to the buccal. And this is why buccal equals opposite. Looking at figure 21-11, the buccal object rule can be used to determine the location of an impacted supernumerary or extra tooth. So first we'll position the patient with the maxillary arch parallel to the floor, and then expose one central lateral incisor periapical receptor using proper technique and angulation. We'll then shift the PID in a distal direction and then expose the canine periapical receptor. In the second image, when the PID was moved in a distal direction, the impacted tooth moved in the same direction. Therefore, the tooth lies to the lingual, which is why lingual equals the same. The right angle technique can be used to determine the position of a radiopaque foreign object. So in order to do this, first we want to look at figure 21-12. And the right angle, first you want to position, after that you want to position the patient with the maxillary arch parallel to the floor and expose one PA receptor using the proper angulation and technique. And in the second picture, you'll expose an occlusal receptor and direct the central ray perpendicular to the receptor. In the occlusal image, you can see that the radiopaque foreign object is seen on the buccal side of the mandible. All right, so the buccal object rule and the right angle technique can also be used to localize orthodontic wire and confirm the location. So let's say that you have a patient come in to the endodontist for root canal therapy on tooth number 30. A small piece of clipped orthodontic wire, which was accidentally left behind during previous treatment and was eventually covered by the buccal mucosa, is revealed by dental imaging. The buccal object rule is used to localize that orthodontic wire, and the right angle technique is also used to confirm the location as follows. So you'll first position the patient with the maxillary arch parallel to the floor. You'll expose one periapical image of tooth number 30. So at this point, a radiopaque artifact is seen near the furcation area, and you can look at figure 21-13 to see this. And then you'll shift the PID in a mesial direction and then expose a second periapical image. In this image, the artifact appears to have moved in a distal direction in the second image. If you want to confirm the location of the radiopaque artifact, expose a mandibular cross-sectional occlusal projection. So see figure 21-13 to see what this looks like. And by using both the buccal object rule and the right angle technique, the orthodontic wire can be localized on the buccal side of the tooth and then surgically removed. Okay, that's all I have for this chapter. As always, if you have any questions, please feel free to email me. If not, Ask Me in Class. We'll talk to you soon. Thanks for listening.